Hey everyone, the numbers show that 60% of men and 50% of women experience at least one traumatic event throughout their lifetime. That's a huge number of people. In the work I do, I specialize in treating trauma. And today, I want to share a bit with you about and answer the question, what is trauma? We'll be talking today about what trauma is, some things you might experience when going through trauma, how trauma is highly personable, and several different types of trauma. So I'm talking about psychological trauma, not physical trauma such as getting hit on your head. Although getting hit on your head can cause things like concussions and traumatic brain injuries, which actually might lead into experienced psychological trauma. Now the word trauma originated in the 17th century from Greek. It originally meant wound. This was for just physical wounds on our body. But nowadays, trauma refers to not just physical wounds, but also mental and emotional ones. Trauma is widespread and does not discriminate. The US Department of Veterans Affairs shows that statistically, 60% or 6 out of every 10 men, or 50%, 5 of 10 of every woman will experience one traumatic event in their lifetime. Now, that's just kind of a general statistic. This can vary hugely based on your ethnicity, gender, cultural background, disability, socioeconomic status, and a wide range of other things which can make that rate higher or lower depending on some of these factors. So what is trauma? Well, when you Google the definition trauma, a variety of definitions come up, all with very similar features. For example, the Merriam-Webster dictionary definition says trauma is a disordered psychic or behavioral state resulting from severe mental or emotional stress or injury. Merriam-Webster also has another definition of trauma that says it's an emotional upset. I kind of like that one a little bit better. In comparison, there's a few other definitions that I think make a little bit more sense. So dictionary.com as well as the American Psychological Association. Dictionary.com tells us plainly that trauma is an experience that produced psychological injury or pain. And the American Psychological Association says that trauma is an emotional response to a terrible event. So does this mean that the majority of the events that most people think will cause trauma will affect everybody equally? Well, this is where the definition gets a little bit trickier. We might all agree that there are some obvious incidents that may traumatize people. For example, natural disasters, war, rape, accidents. But there are a whole host of other life events that may be traumatic and that cause someone to be traumatized. Through my own clinical work and from the scientific literature, from research in the field, from both biopsychology and neuroscience, Dr. Bessel Van der Kolk, who is one of the world-renowned psychologists in treating trauma, says that trauma is an event or events that overwhelm the central nervous system, altering the way that we process and recall memories. It's any experience that overwhelms your thoughts, your emotions, your body, and your spirit. Simply put, I like to explain it as experiencing either too much too soon, too much for too long, or too little of something for too long. Trauma, I believe, is highly individualized, meaning that we all react differently to the same situation. I really like this definition because it allows us to see a broader range of experiences, and it acknowledges that traumatic experiences affect everyone a bit differently. From well-known experiences, like I mentioned, war, rape, accidents, natural disasters, to lesser obvious examples, such as long-lasting neglect, growing up without emotional warmth, attachment, connection, having to be a parent while you're a child, divorce within the family, someone going into prison, medical trauma, procedures, unfaithfulness, significant loss of a person or pet, loss involving a sense of who you are, financial loss, stress, spiritual, moral injuries, the list goes on. Now, what does being traumatized mean? It's important to mention experiencing a traumatic event. You may have normal reactions such as shock, denial. You might experience what you might have heard this before, fight, flight, or freeze response, where your body is responding to stress and difficult situations. However, depending on a wide range of circumstances, you might experience a reduction of these symptoms soon after the traumatic experience. But on the other hand, you might experience long-lasting emotional, mental, physical, and spiritual effects. Some of these impacts, for example, might be sleep disturbances, alteration in appetites, nightmares, flashbacks, rapid changes in mood, easily more irritable, increased anxiety, increased depression. These are just to name a few. Now, a bit earlier I said that we all may react differently to the same situation. Trauma can affect us all. It doesn't discriminate, but affects us all to varying degrees. And the same event may traumatize one person, but not another. Let me give you an example to understand this a bit better. Let's say that we have two people, bystander A and bystander B, that are witnessing a severe accident where someone is getting hurt. Bystander A has a huge reaction afterwards. They experience a lot of those symptoms that I mentioned earlier, have troubles coping with what they've seen, whereas bystander B sees the accident and in a few days is able to go on with their regular routine and schedule and able to function as normal, as usual. Why the difference? They both saw this severe accident with someone being really hurt. Well, if we consider some background, bystander A, and this is just for an example, bystander A might have a history of other traumatic events that they've gone through. They might be also more vulnerable to stress. They might be going through a lot of different stressors in their life, and they may have no one in their life that they can turn to and talk to about and work through what they've seen and experienced. Bystander B, on the other hand, might have all the opposite, a very supportive system that they could talk to that evening, right after the accident, someone they were able to call right away. They might have no experience with other traumas before, therefore their system might not be as taxed. Now here's the interesting thing. You could have bystander B have all those things in place, supports, not a lot of trauma in the past, yet see that event and still be traumatized. Therefore, trauma is highly personable, and I like viewing trauma in this way because it helps us understand what people are going through, and it reduces a sense of shame and judgment. Lastly, I want to very briefly mention several kinds of trauma. I'll talk more about these in other videos, but the several kinds are acute, chronic, complex, and secondary or vicarious trauma. Acute trauma is something that happens very quickly. It might be a one-time thing and then it's over. For example, someone going through a natural disaster. Chronic trauma is repeated events happening over time. For example, continued abuse within a relationship. Complex trauma typically involves a combination of both immediate events of acute over time as well as chronic ones that continue to happen. They usually have layering of trauma on top of trauma, and as well as something that you might have heard of, developmental or childhood trauma, typically things with neglect, abandonment, emotional, physical, sexual abuse, verbal abuse, parentification. And finally, there's secondary or vicarious trauma, which is trauma that we experience being exposed to someone else's suffering. For example, first responders and those in the healthcare professional, nurses, doctors are a very common example. And I hope some of this information has been helpful for you today. If you've experienced trauma in your life or you're currently working through a bunch of trauma symptoms and experiences and stuff that's kind of coming up for you today, or maybe if this video brought up a little bit of anxiety for you, I've created a bunch of resources that you can check out in the description below or in the links after the video that you can use that have practical skills for you to go to and use to help work with your nervous system and calm your body down if you're having a tough time. So if you feel that those might be useful for yourself or maybe one of your loved ones, please, I invite you to check them out. So thank you so much for taking the time today to listen about what is trauma. There might be a lot of other pieces to this definition because It's constantly, as the research is going, it's constantly evolving. So if you have a perspective or thoughts or insights that, I might not have mentioned in here because there's probably a lot I missed today, please put them in the comments and we can have a discussion about it, and we can add it to another video that I'll have in the future around this. So thanks again for tuning in, and take good care of yourself.